Hello, happy Thursday. Welcome to a Lunch and Learn with Purse Strings. My name is Maggie Nielsen, and I'm a partner here at Purse Strings. And we do these live sessions to get some information and knowledge out to our communities of women to help them really equip them to make better financial decisions. And we always bring on our Purse Strings approved professionals to give us this great information. These are all professionals who have been vetted and approved and really specialize in working with women. And Andria Bovey is here today, and we are going to be talking about Medicare coverage and getting prepared for open enrollment going into 2024, which is wild to say. But before we dive into all of that, Andrea, could you give us a little intro of who you are and what you do?
Yeah, hi Maggie. My business is called Bovey Insurance. Bovey is my last name, obviously, and I'm coming to you from Yuma, Arizona, which is all the way down almost to Mexico in the state of Arizona. And I am licensed in a lot of states, and I was contacted by Purse Strings a couple of years ago, and I'm just delighted to be a member. My business has been in place for 15 years now. I'm in my 15th year.
Wow, congratulations. That's exciting. So yeah, we're excited to dive into this Medicare conversation today. And if anyone has questions along the way, please throw them in the chat. We're happy to help you answer those throughout. And if you're watching the replay, you can still put them in the comments and we'll work on getting back to those. So let's just kind of dive in. I know you have some great information to share with us about Medicare coverage and open enrollment period.
Yeah, I've asked Maggie if I could just have the first 5 minutes, and then I know she's got some questions, and she's been gracious enough to grant me that. So I think it would be good if we defined what Medicare is. And it's our health insurance for when we turn 65 years of age, or if we've been disabled for 24 months and we're under age 65, and then we're automatically a Medicare enrollee at that point. So it's not just when we're 65. And when that happens, we go to the Social Security website or make an appointment, usually, and we sign up for what is called Medicare Part A and Part B. That's the little red, white, and blue card that you've seen advertised that people receive. So Part A is hospital, and Part B is doctor and everything else. So inpatient, outpatient is another way to look at that. And Medicare itself, when we are a Medicare enrollee, pays for roughly 80%, and then what is called a Medicare beneficiary, it's the proper term, a Medicare beneficiary, someone who has Part A and Part B, then they're responsible for the other 20%. So this is the time of year where we're seeing all of these commercials every second of every day, it feels like, talking about this plan and this benefit and all of these bells and whistles and all this kind of stuff, because in certain conditions, this is when people can change plans. And we'll kind of go into that a little later on. So Part A, Part B. If people continue to work past 65, they often delay signing up for Part B because they have qualified health coverage to their employer, and that Part B plan has a premium that you have to pay every month. Part A, typically the hospital side, typically there's no premium, and so people go right forward with that because they've worked enough quarters to qualify for a free Part A premium. So I know that gets us in the weeds a little bit already. So that 20% that I talked about, people typically buy coverage to cover the gap. So sometimes it's called Medigap, the gap between what Medicare pays and what the beneficiary might be responsible for. And there's two ways that people do that. One is with something called a Medicare supplement, and then a standalone prescription drug plan or PDP plan, or something called a Medicare Advantage. And they're very different in the way they work. And so people have to make that decision. But right now, at the end of the year, people who want a Medicare Advantage plan or a different one that they have, or a different drug plan, this is the time of year, the annual election period, that people are scrambling and can change. Scrambling is too dramatic of a word. When people are needing to consider whether they want to make a plan, because they can only do that. Agents get notification of what the changes are to plans around the 1st of October, and now we're booking with our clients. So from October 15th to December 7th, those Medicare beneficiaries can move without any underwriting or anything into a new Medicare Advantage plan or a new prescription drug plan for an effective date of January 1st of 2024, which sounds like months and months from now, but look at where we are, as you mentioned, okay? So hopefully we'll have a little time to talk about the differences between supplement and Medicare Advantage. But if I could provide our listeners, because I guess I'm part of this community too, right? Our listeners, there were some big compliance changes for Medicare agents. And so the financial advisors out here and the attorneys and the people helping people through divorces and whatnot, you may have clients come back to you and say, I don't understand this agent and I don't want to work with this agent. And you maybe shouldn't refer to this agent because they want to do all of these kinds of things. We're now required for the Medicare Advantage and the prescription drug plans to record every conversation we have in the sales and marketing cycle, even with an existing policyholder. And we've got to retain those recordings for 10 years. Wow. And the other thing we have to do is state a disclaimer. And I'm going to read it because It's fast. We do not offer every plan available in your area. Currently, we represent, insert the number based upon where I am or what state I'm talking in. Currently, I represent 13 organizations which offer 42 plans in your area. Please contact Medicare.gov, 1-800-Medicare, blah, 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 blah. So every call, we have to make that disclaimer to people. So people don't want to be recorded, and I'm already having some pushback. I'll go somewhere else. I don't want to be recorded. Why are you doing this to me? I'm not doing it to them. Right? And we agents believe that this has occurred because of all of these commercials you see at the end of the line and all of these call centers and the way they have handled Medicare beneficiaries. And so CMS, Centers for Medicare and Medicaid, have implemented these requirements.
Wow.
Yeah, so it's kind of a big deal. So I want the financial advisors and the attorneys and the people in this community to know that it isn't the agents that are pushing this, and to kind of ease people in or say, no, it's new changes and it's to protect consumers and to make sure you get plans that are proper for you and that there's a way to go back and analyze a complaint if there is one, etc. And now let me give your agenda back to you. Thank you.
Yeah. I'm glad you shared a lot of this great information, because even as just someone calling in, you need to know that it's being recorded and understand why this is happening. And even when you list of let's say you are allowed to do 13 companies with 43 programs or something like that, it's, as somebody who's a newbie, I don't know if that's a good amount of options, if that's all the options, if I should look for someone who has more options, which, sometimes more options are just overwhelming. But what should people be, looking for? Like, are there key numbers people should look for? Like, at least they offer so many options, or?
Oh no, not at all. 3 or 4 or 5 good options in an area might be more than enough. I want to look at companies that have a strong footprint across the country. Yep. So that if somebody, because a lot of times if people move, they've got to get a new plan in their area because there are networks with these Advantage plans and whatnot. So no, it isn't about that. What is the strongest reason for somebody to be placed in a plan is stable rate history, and that their doctors are in their network, their primary care providers, their specialists, that kind of thing, are in that network. And we switch people from one plan to another if their doctor leaves the network or they have relocated to a different area. And that the medications they take are in formulary. We'll talk about formulary in a second because we probably should define that. So their medications are available within that plan as well. And perhaps the pharmacy that they really insist upon filling at is a preferred pharmacy, so they get the lowest prescription drug cost.
Got it.
So formulary is a list of drugs that that particular plan offers, and they come in tiers. So the preferred generics are in tier 1, regular generics tier 2, et cetera, and of course the tiers, more costly drugs as you get up to like tier 5 and that kind of stuff. But it's just a term for the medications that are available in that plan.
It's interesting. I would never think that some are covered and some are not per each plan, but of course it's laid out that way. And so a question that we have coming in is it also true that, on the phone, they can only talk about Medicare and no other products?
Yes, that is true. So, and I think what the question means is, if somebody called in and I happen to say, oh, could I sell you, I also would like to talk about this hospital indemnity plan or this critical illness plan. I cannot do that in that format.
Oh,
I
interesting.
cannot introduce other things in the course of that. I can follow up afterwards and say this might be something you'd want to consider, but we are not allowed to do that through the process.
Interesting. Okay. And so can we dive back into a little bit about the supplement and the Medicare Advantage and why you might pick one or the other or do this, change at this period of time?
Yes. So the supplement plans are letters, like there's a plan F and a plan G and a plan N. So G and N are the most popular across the country. And with those, the policyholder and the doctor basically make decisions about what treatment people need to get. So the doctor recommends that I need to have a hernia surgery. We work with the plan to get that approved and get that scheduled and get that done, kind of thing. My parents were snowbirds for years, going from Idaho to Arizona. And they always had a Medicare supplement plan because they were 6 months in Idaho, 6 months in Arizona. And with a supplement plan, you can see any doctor you want to, providing they're accepting Medicare and taking new patients. But it really works for people that are in two places for a long period of time. With an Advantage plan, there are networks, and sometimes there's not, depending on the type of Medicare Advantage plan, you may not have coverage out of your network area.
Mm.
So for instance, if I went from Arizona and spent quite a bit of time in Texas, I may not have doctors I can see. Now that's a little of an oversimplification because some of the big plans have something of a national network. And if I had an emergency situation, I would be able to treat in an emergency. But generally speaking, routine medical care I need to do with network doctors in my area. So those are the main things that drive, and price. The Medicare supplement plan has a higher monthly cost. The Advantage plans have no cost or very small cost, but they have co-pays, maximum out of pockets, things like that to deal with.
So once you start receiving or using Medicare, is this something then you should go and assess every year at this open enrollment period?
So I reach out, yes, perhaps. I place people in a plan that they'll use for many years, even on a Medicare Advantage. And so I'm contacting my clients every year. I start in September typically, and I'm reaching out to them to tell them to watch out for their ANOC, annual notice of changes.
Okay.
That will tell them what's going to change in their plan. So if they have changed doctors or they're having trouble getting services with their doctors on their existing plan, they have new medications, they've relocated, those are good reasons to consider changing plans. Chasing a widget or a shiny object attached to a plan that's advertised on TV is not necessarily the reason to change plans.
Really?
So last year, for instance, here's a great example. So last year, for instance, the Medicare Advantage plans, one of them that starts with an H, was advertising a lot that they were covering the shingles shots, which was new. Well, almost all of the big ones did. So I got a lot of calls, and they said, should I be switching over to that plan from the one that you've got me on, because I'd like to have that covered. Those are expensive vaccinations, expensive injections. And I said, well, the plan you have will do the same.
It's all about how you advertise yourself and kind of put it out there, I guess, right?
Yeah. So people chase a lot of shiny objects, but sometimes what they've got is really great. And there's something to be said for a smooth process with your doctor and smooth claims payments and smooth.
Yeah, definitely. And sometimes, you don't know what your plan entails until you need that thing, because you weren't looking for this specific prescription until all of a sudden you needed it, I mean, because there's so many different things that you could take, that you could see, that, all these different moving parts out there.
Yeah. Yeah.
And so are there other opportunities for people to change their Medicare like beneficiaries to make a change of coverage outside of this open enrollment period, or is this the only time and you're locked in?
So when you first turn 65 or you've quit employment and are now going to go on to a Medicare plan, you have a special enrollment period because now you're going for the first time onto Medicare. But if you're on the Medicare Advantage side and the prescription drug coverage plan side, typically it is just this point at the end of the year. There can be some reasons that you can change otherwise, like moving to another area. Moving into assisted living or skilled nursing can create that. Getting a chronic illness, which means that you might have a special chronic illness plan that would be suitable for you. A big reduction in income where now you could get access to maybe a different plan or your plan, but also get some help with some of your costs. But generally speaking, yes, this is the only time on the Medicare Advantage prescription drug side.
Okay. All right. And so then can you share a little bit about either how you're paid in this transition or why someone might want to call you versus calling one of those constant advertisements on the television? And what makes it different? Are you more expensive? Why would you call one or the other?
Related to that question, I really encourage people to work with an agent rather than just going online or to Medicare.gov and signing up themselves.
Agreed.
Unless they've worked in the industry or in a hospital system or something like that, because they will not pay any more to have an agent than to not have an agent. And then they've got somebody that they can call. The 1-800 lines that are advertised on television are call centers. And in many cases, I don't want to be rude to them. They're a business as well. But in many cases, they're only talking to people about the Medicare Advantage plans. And don't inform consumers that there's such a thing as a Medicare supplement. And some people are better off in a Medicare supplement. And the truth is, Maggie, that we agents are paid almost twice as much to sell the Advantage plans as the supplement. And so there are some agents that will not even talk to people about the fact that there are supplements in place that might be suitable for them. So I'm one of these people that gets up every day and says, do the next right thing. Yeah. So I don't care which way people go if they're informed and they have made the right decision for the way they approach risk and how they want to manage this particular risk, which is their health care in their later years.
Yeah, and you can't beat, talking to you every time versus who knows who you're going to get in the call center. But I think it's just so important to highlight that if you do it on your own or if you do it with you, it's still the same price.
Yeah, and these companies, as people are approaching their 65th birthday, are calling. They're blowing people's phones up. And there's lots of mail coming out and all kinds of stuff.
Those really fake signed happy birthday cards. It's also give me a call.
I didn't see anything like that, but there are people who really get a lot of phone calls and stuff. They get on all these call lists, and all these companies are calling saying, hello, Cookie Dough. Hello, Cookie Dough. I understand that your birthday is in August and you'll be turning 65. Is that correct? Yeah, and then they want to transfer you right to an agent, and they want to just sign you up right there with.
And so we did just have a question come in, and that says, I still have insurance, but it sounds like I still need to sign up for Medicare since I will be turning 65. Do I have two insurance plans then?
So she probably has creditable coverage and will not need to sign up for Part B, but probably will need to sign up for Part A. And her benefits department can advise her about that because there's a little bit different rules for big companies and small companies. Mm-hmm. And she can make an appointment with the Social Security Administration, or she can do it online, or go into the Social Security Administration office and ask those questions. But I believe the answer is yes, she'll sign up. I don't know that it's a woman. The person should. Sorry about that. The person probably will sign up for Part A, and if they're going to continue to work, delay Part B, because that this year is a cost of $164.90 a month. So there's no reason to have the Part B, which is the doctor and outpatient stuff, because that'll cover it. But you might as well get that Part A out of the way because there's no premium, and then you've got it started, and then the Part B can be added. Through COVID, I had several clients do that, in fact, where we didn't get them on a Medicare plan, but worked them through that process.
Awesome. And so is that 162, 167, whatever you said, is that gone up? Is that going down from the year before?
This year, it went down from the prior year a little bit. And we won't know until next month what the new rate is going to be, but the gossip on the street says it'll be about $10 a month more. So this month, the Part B premium, $164.90. So I think we'll be about $175, but we have to wait and see. Not announced till next month.
The suspicion. We'll be waiting.
And
Awesome.
no matter what, you can't get out of paying that. So
Yeah. I think this has been a lot of great information. Is there stuff that we haven't touched on that you think needs to be shared?
yeah, I want to, the person who was talking about working, be sure to talk to your benefits department and make sure that your coverage is going to be creditable. And at some point when you move to Medicare, you're going to need a statement from them to demonstrate that you had creditable coverage. That's a whole terrible word to have to say, because there can be late enrollment penalties for not getting Part B and the drug plan and stuff when you turn 65 without having that creditable coverage. And COBRA is not creditable.
That's a good
You're hanging around. Yeah, hashtags, that doesn't work. So I think I've covered it. It can be a lot to, I want to talk about the disclaimer and the recording of calls so people knew that that was going to be something coming up here. And that we just have to be really good professional agents and not be hinky with people.
Yeah, definitely. And so what is the best way for people to reach out to you if they have more questions, want to work with you to, help get the right coverage and ask any more questions?
Yeah, I'd love people to go to my website, boveyinsurance.com. There's all of the kinds of insurance that I work with. Under 65 healthcare, I've got a really spectacular plan that's not part of the marketplace or the Affordable Care Act that I'm working with in, I think, the 23 states I'm licensed in, or most of them. I do long-term care planning, and that's what I started with doing as a specialty 15 years ago. And there's a link to my calendar for all of those different types of inquiries people want to make. And I can be reached at, I'll say my phone number, 928-482-6800.
Awesome. Well, yeah, thank you for coming on and bringing this information, as I know it's so important since the season is coming up, and it sounds like a pretty short season for you to, get in contact with all your clients and make everything happen.
Well, yes, and a lot of things come up with the under 65 market. That starts basically November 1st or the end of the year. So why on God's green earth did all this stuff happen at one time?
That's how we have fun with it.
We do have fun with it.
But I appreciate you coming on and sharing your expertise. Andria's email has been going through the bottom, andria@boveyinsurance.com, and you can also check her out on our website, pursestrings.co. So please reach out and just schedule a call. Does no harm. It's just going to be full of great information. So thank you again, Andria, and we'll talk to everyone soon.
Please know I'm happy to answer questions. It's harder to do this time of year, but I will do my very best if you'll just have patience and leave me voice messages, because I'm often on Zoom calls helping clients, but I'm happy to just field questions.
Awesome. Sounds great. Thank you again.
No pressure from me.
All right. Talk to everyone soon. Bye.
Bye. Thank you, Maggie.
Yeah.